Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Health Care. We're talking about prehabilitation, a treatment that could be helpful for some patients, and in certain conditions like breast cancer, it is highly recommended.
Prehabilitation is exercise used before an intervention like surgery, chemotherapy, or radiation to improve the outcome after the intervention. Rehabilitation is exercise therapy after the intervention.
How do breast cancer patients benefit from prehabilitation services?
Our breast cancer patients that have shoulder problems benefit most from prehabilitation services. Whether it's rotator cuff tendonitis or a shoulder replacement, any surgery on the breast can affect the armpit or the shoulder and give the patients discomfort. So if they already have a shoulder problem, you can imagine how that can compound the issue. The other issue we sometimes deal with is anyone recommended for radiation. The position for radiation is actually the arm behind the head like this. That can be particularly difficult with someone with a shoulder problem, so we'd like to intervene on that shoulder problem as soon as possible.
Are there other medical conditions that can benefit from prehabilitation?
We do prehabilitation here in our joint center for our hip and knee replacement patients, and those patients do very well as well. Any type of cancer, I'm happy to see patients with any type of cancer for prehabilitation recommendations.
Are there exercises designed specifically for breast cancer patients?
So we tend to focus on the shoulder for breast prehabilitation, and the most generic exercise I can recommend that's typically safe for all patients would be to find something to hold on to and lean over and do little circles with the shoulder. That's called Codman's exercises, or some patients call it pendulums.
How often should these exercises be done?
We generally recommend doing the exercises daily. I typically recommend 3 sets of 10. Some patients that struggle with the exercises will separate those 3 sets for 3 times a day, and some patients will just do them all in the morning to get them out of the way. I do think the pendulums or the swinging exercise of the shoulder are most effective in the morning because they can often loosen up the shoulder for the whole day.
How do patients get into breast cancer prehab?
There are many ways for patients to get into prehabilitation here at UMass. Some patients will be referred to me, and I'm happy to see patients with any type of cancer for this issue. They could be referred by their oncologist to physical or occupational therapy here at UMass at our Hanneman campus.